A recent study concerning gender disparities in HIV treatment outcomes following release from jail, published in the American Journal of Public Health, showed that HIV-infected women experience worse treatment outcomes after release from jail. Joining me this morning is the lead author of the study, Dr. Jaimie Meyer. Dr. Meyer is with the Section of Infectious Diseases AIDS program at the Yale University School of Medicine. Hello, Dr. Meyer, and thanks for talking to me today.
Hi, thanks for having me.
Great. First off, you say that HIV, the human immunodeficiency virus, is very prevalent in people in the prison system, regardless of gender. What factors make this so? Why is HIV such a prominent thing in the prison system?
Right. So in the United States especially, the HIV epidemic is really concentrated in the criminal justice system, and about 1 in 6 people living with HIV in the U.S. pass through prisons and jails every year. So, and part of the reason for that is that the same types of risk behaviors that go along with HIV are the same types of risk behaviors that go along with incarceration. So, things like ongoing drug use, especially injection drug use, commercial sex work, and honestly, factors like, severe mental illness and homelessness. I mean, these are all sort of risk factors that are common for both HIV and incarceration.
Okay, very good. Okay, well, let's go ahead and get to the study then. You looked at gender differences in HIV treatment outcomes in HIV-infected prisoners going back into the community, getting back out into the public. It was a multi-state study, and about a third of the participants were women. And what you found were the women were a lot less likely to get HIV treatment after getting out of jail. Can you elaborate on that based on your study?
Sure. So again, this is a multi-site, multi-state study sponsored by HRSA, and the majority, it involves about 1,300 HIV-infected jail detainees who were all about to leave jail, and the majority of participants actually came from Rikers Island in New York City. And what we basically looked at is people's engagement in HIV care, because that's just something that's really important for the treatment of this disease. It's a lifelong chronic disease, requires engagement in care. So we looked at people's reports of, engagement, having an HIV provider, taking antiretroviral therapy for their HIV, adhering to that therapy, and having sort of optimal outcomes, which are able to get the levels of virus in their blood so low that it was, best for their health. And so what we found is that prior to coming into jail, women did worse than men on every single one of these markers. And 6 months after leaving jail, women were a lot less likely than men to have an HIV provider, to be taking meds, to be adhering to their meds, and then to having sort of success with treating their HIV. And even after you look at a lot of different other factors, women are about half as likely as men to have success in treating their HIV 6 months after release from jail.
Sure. So I guess the follow-up question to that would be, why? Why are women less likely to follow up?
Right. So we found some really important other differences between women and men that we think might be contributing, and that are that this population of women was a lot more likely than men to be homeless, to have ongoing cocaine use, and to be experiencing ongoing depression. And even though as part of this study they received a lot of support services and case management, I think it's possible that we just weren't able to take care of those particular needs the way that they needed in order to engage in care.
Yeah, and of course, this can lead to much more advanced health problems.
in terms of not treating their HIV.
Sure. I mean, they can go on to
right.
a better chance of going on to full-blown AIDS, et cetera.
Yeah, so achieving success in terms of their HIV treatment outcomes not only puts them at increased risk of, HIV-associated diseases and non-HIV-associated diseases and deaths related to their HIV, but it also puts them at higher risk of transmitting HIV to others.
Sure. And finally, what can be done to help women that need this treatment to get it?
So I think that what this study really suggests is that we need sort of specific approaches geared to women with HIV who are leaving prison and jail and transitioning back into communities. We need things, interventions and programs that sort of directed towards their specific needs, because clearly, they have needs that are different from the men who are leaving, and that's important for the HIV epidemic in this country. It's a population that sort of deserves special attention.
Very good. Well, it was a very interesting study, I must say. I would like to thank Dr. Jaimie Meyer with the Yale University School of Medicine and the lead author of the study. Thanks for lending your expertise today, Jaimie.
Thanks so much for having me.
You bet. Bye-bye.